Clare. The question is that the Federation Chamber do now adjourn. I call the member for Hotham.
Thank you so much, Deputy Speaker. Deputy Speaker, when Labor introduced Medicare to the Australian Parliament, the Prime Minister at the time, Bob Hawke, said that without it, 2 million people face potential financial ruin in the event of major illness. In one real policy statement, Labor was able to take a health system that was unfair, that wasn't working properly, and create a new health system which all Australians will be able to benefit from. There are some very simple core principles that sit under Medicare and the health system that we've been able to create and to defend over the last 30 years. One of those very clearly, Deputy Speaker, is that all Australians should have access to high quality health care. And we also believe, Deputy Speaker, that because someone contracts a major illness or chronic disease, that shouldn't automatically mean that they and their family descend into poverty. Now, Speaker, over the last 30 years, Labor has had to fight tooth and nail to protect Medicare, to protect the veracity of our healthcare system. And unfortunately, it's something that I've had to do. I've had to work very hard at over the last 2 years that I've been a Member of Parliament. Because what we've seen over that last 2 years is more or less constant attacks on the principles that underpin this system. And we saw a particularly egregious example, Deputy Speaker, last weekend when the Health Minister, Susan Ley, announced that she would be putting into the field a private health insurance survey, which, when you looked at the questions, Deputy Speaker, asked some very clearly leading questions about how Australians feel that private health insurers should rate the risk that they present to insurers in calculating how much their premiums should be. What this sort of probably sounds very technical and innocuous, Deputy Speaker, but it's absolutely not. It's fundamental and is a very clear indication of this minister's constant attempts to try to Americanise our health system here in Australia. Deputy Speaker, I do want to explain to those listening what it is that is so important about this principle. In Australia, the way that the risk of patients to healthcare providers is calculated is on something called a community rating. What that means is that under Australian law, a health insurer can't charge you more for your health insurance because you have, for example, a long family history of breast cancer. They can't charge Australians more for health insurance because they live in a part of the country where there are much higher rates of obesity. They can't charge elderly Australians, Deputy Speaker, who are looking into a more expensive period of healthcare costs, more for their insurance because of those increased risks. Deputy Speaker, this is fundamental to our system. We need to have an insurance-based system which ensures that whatever walk of life you come from, you get the same risk rating. This is absolutely essential to the system that we have in place. So, Deputy Speaker, that's why Labor has come out so strongly this week to say that this is unacceptable, that we do not support a change to the way that risk is calculated for Australians. Deputy Speaker, what is so disappointing about this is that it is part of a broader pattern that we've seen over 2 years of this government, first the Abbott and now the Turnbull government, trying to undermine the planks of our healthcare system. People often don't believe politicians when they talk about relentless efforts to undermine systems, so I actually want to articulate some of the cuts and attacks that we've had to defend. More than $60 billion, Deputy Speaker, has been cut in the forward budgets for our hospitals. $370 million has been cut from preventative health care. Hundreds of millions of dollars has been cut from dental health care. We've seen millions stripped from mental health budgets and from Indigenous health care. And let's not forget, of course, Deputy Speaker, the GP tax, again an attempt to impose more costs onto the people of Australia who are consuming health care. Alongside the GP tax, of course, we also saw attempts to change the cost of medicines under the pharmaceutical benefit scheme. In almost all cases, Deputy Speaker, Labor has opposed these changes, and we will always be defenders of the great healthcare system we have in Australia. Deputy Speaker, I say that we'll continue to defend this system, not just because it's fair and not just because it fits so perfectly within our values as Labor people, but because this is a system that really works. In fact, most Australians probably don't know, we have one of the best healthcare systems in the world. We know that because we get fantastic health outcomes in low infant mortality rates, really long life expectancy compared to other countries. But our healthcare costs in this country are actually kept quite low when we look at other countries who are achieving those great results. So, Deputy Speaker, I see our health budget as an investment in the welfare of the people that we represent. Nothing could be more fundamental to us as members of Parliament in protecting that, and I'll continue to stand with Labor to do that over the course of my life as a member of Parliament.
Thank you very much, Member for Hotham.